Okay, number 75 of the most common post-COVID symptoms is called burning sensation. Now, this has a sensation of burning, so a sensation of heat being applied when it actually is not to a certain area or generalized, called a, quote, burning sensation. And again, this was in approximately 5% of patients surveyed reported this as a post-COVID-19 symptom. Now, I would worry about this. Burning sensation is one of the usual symptoms that's described for a neuropathy. And again, we're dealing here with a lot of neurological signs and symptoms, as the virus does affect the nervous system in many patients. So it can cause a peripheral neuropathy, especially if this is lasting more than a few days or a week. I would get this checked out and make sure you're not developing a peripheral neuropathy. So again, the burning sensation indicates nerve inflammation or nerve irritation, which can occur. This virus is known to cause that. And also, if it's, let's say, for example, in the chest, and I would worry about a cardiac cause, because that can be a symptom of cardiac. And more frequently from this virus is pneumonia, pneumonitis, and pleurisy. If the burning sensation is isolated to the chest, and especially if it's pleuritic, which means the pain comes and goes as you breathe. So it's associated with the movement of respiration. That's called pleuritic chest pain, and that indicates that the lining of the lung is being irritated by the infection, and this should be checked out. This can be serious, especially if the symptoms are getting worse, and especially if they're prolonged. This is a definite complication of COVID-19 symptoms directly. Okay, the next most common symptom of post-COVID-19 is a painful scalp. Now again, this kind of goes along with this may be a burning sensation. This goes along with the last symptom, which may be neuropathy, but it could also go along with a headache. So a burning scalp may indicate nerve injury or even brain inflammation if it's long-term, getting worse, lasting more than a few days, or associated with other signs or symptoms. You should see your doctor or clinic immediately if there's a lot of neurological symptoms, especially. This could indicate something more serious. So the next, number 77 most common COVID-19 symptom is jaw pain. And jaw pain could be various different things. If the whole jaw is involved, that's kind of unusual. Could be another cause, such as a abscessed tooth or gum infection, oral infection, as we discussed previously, or if it's in the TMJs, the temporal mandibular joints, which are just below the ears on either side. This could indicate inflammation of the TM joint, or TMJ, as it's called. Another thing I will worry about is cardiac pain. That's heart pain, can be referred to the jaw. And I've seen patients, and it's documented well in the literature, that just this isolated jaw pain can be a significant symptom of cardiac pain. So if you don't know exactly why, you should get this checked out. Especially if you have other signs and symptoms, definitely get a medical workup for this. Okay, the next most common, number 78, symptom of post-COVID-19 is called dysrhythmia, or actually, as it was in the questionnaire, arrhythmia. The problem with the word arrhythmia means you have no rhythm, then you would be dead, and so I really doubt that. Dysrhythmia means there's an abnormality of the cardiac rhythm. So your heart is doing weird things, skipping around or something like that, or fast or slow. But some abnormality of the cardiac rhythm was reported in approximately 5% of people who responded to the survey. And this can be significant. Most people have what's called Pvcs, or premature atrial contractions, and most people don't notice them, or you may notice an occasional skipping of your heartbeat, which doesn't cause any other symptom other than the notification that your heart did that. But if you have other symptoms associated with that, then yes, you should definitely get it checked out. If they're new onset, if you just started it after having COVID-19, then definitely get that checked out. You need to make sure they're not what's called Pvcs, or premature ventricular contractions, which indicate something more serious and can lead to other more serious problems, and can be signs of, for example, a heart attack. So especially if you're having some cardiac symptom, let's say in the last number, you're having jaw pain, and then you're having palpitations or, quote, dysrhythmia, unquote, then yes, you might need to get immediately to the hospital and get it checked out. If it's cardiac, normally they recommend, you get to a hospital emergency, so if it's considered cardiac, call 911. If it's probably not, then maybe you can see your own doctor. But if you're having other symptoms, I would probably call 911, because this could indicate a heart problem, as has been seen with COVID-19 as a post-symptom. So definitely get it checked out. This can be a serious symptom. It's new onset, especially associated with any other symptoms. 911 may be indicated. Okay, the next most common post-COVID symptom was number 79, and this was quoted as low oxygen level. Now again, I ask, how do these people know they have a low oxygen level? Unless they have a pulse oximeter, which measures the oxygen level, which would be a little bit unusual why they're doing that. But some people do have a pulse oximeter. I, as a physician, have many pulse oximeters, and on every visit I used to measure the patient's pulse oximetry. So I would say it's a little unusual that a person knows they have a low oxygen level. If this is associated with other signs or symptoms, which usually it would be, then yes, you should be evaluated immediately. So if you have chest pain, shortness of breath, cough, sputum, colored sputum, or any of the other symptoms noted above, or a collection of symptoms, then yes, you need to call 911, get evaluated immediately, as there is something else happening that is potentially more serious than just a COVID-19 post-symptom. Okay, I would also say that, bugs. Okay, if you're measuring your oxygen level and it suddenly goes low, I would repeat it, make sure it's accurate, check, maybe repeat it on someone else, make sure that it's not just your meter that's malfunctioning or the batteries are going dead, to make sure the reading's accurate. But if you've had a sudden drop in oxygen saturation, which is what this symptom supposedly is, then that's significant, and I would either get to the emergency immediately, call 911, get to the hospital, especially if you're having other signs or symptoms, which if your oxygen level suddenly dropping, I can almost assure you you are having other signs and symptoms. Unless, again, your pulse oximetry device is malfunctioning, batteries going dead, terminals not clean, something like that. So anyway, if it really is low oxygen, suddenly call 911. Okay, the next most common post-COVID-19 symptom is number 80, burning in the lungs. Okay, this goes along with some of these other symptoms that we've had with low numbers in the 5% of patients responding to the survey. So again, burning in the lungs, that's usually very significant, especially if associated with other signs or symptoms. Burning in the lung indicate inflammation or infection in the lungs, indicate something else going on that's more serious as a complication of post-COVID-19. And I would think usually pneumonia, pneumonitis, pleurisy, fibrosis are some of the things that can develop post-COVID-19 and lead to burning in the lungs. Okay, again, a sudden onset of burning in the lungs can be very serious, possibly a call to 911, especially if associated with other symptoms or a sudden onset and lasting more than a few minutes. Again, there's a potential burning in the lung, maybe cardiac in a small percentage of patients, so that needs to be taken into consideration as well. Okay, the next most common symptom of post-COVID-19 is number 81, cracked or dry lips. This may be a sign of a post-viral infection and is very common after many types of infections, even the flu and the COVID coronaviruses. So this may be a normal side effect directly from the virus, and it's probably associated with the desquamating or peeling skin that I mentioned earlier, but also can indicate dehydration. So if you see this, you may need more fluids, especially if your tongue and throat are dry. You can check your skin turgor, take the back of your hand and pinch the skin and see if it falls back into place normally, or does it tent and stay up elevated, which indicates poor hydration. The other thing other than hydration is that it can indicate secondary infection. For example, some people who developed pneumonia developed sores and dry, cracking skin in their mouth and on their lips. And this is one of the signs of pneumonia and pneumonitis, secondary to bacterial infection, as a post-COVID-19 complication. So, especially if you have other signs or symptoms, I would worry about other types of infection, especially if you have such as shortness of breath, wheezing, coughing, phlegm, then I would worry about this. Dry, cracking lips by themselves may just indicate sun exposure can do that, can dry your skin and lips, as well as the dehydration I mentioned earlier. And if it's by itself, maybe not too much of a concern, but if associated with other signs or symptoms, again, please get that checked out. Okay, the next most common symptom of post-COVID-19 is number 83, foot pain. Now, again, this is a isolated symptom of the foot. We mentioned hands and wrist before. We mentioned the neck. We mentioned isolated joints. But approximately 5% of people had isolated foot pain. Now, I guess it's significant if it's both feet or just one foot. Can determine the investigation, what needs to be done. If it's both feet, one might think of neuropathy, because usually it affects both sides, as it's a metabolic inflammatory type thing. If it's just one foot, maybe you have an injury, maybe you have a blood clot. So make sure you don't have any other signs or symptoms. There are associated blood clots with post-COVID-19. So especially if there's swelling, redness, if when you move your foot up and down, you get pain in the back of your calf. That's called a Homan sign, Homan ''S. And that is significant for thrombophlebitis or blood clot in the leg, which can happen after a serious infection, can happen after immobility for a period of time, and due to the hypercoagulable state after post-COVID-19. So again, a single isolated one-sided foot pain, one would have to consider a blood clot as post-COVID-19 symptom. So please get this checked out. Both-sided pain, more likely neuropathy, but also can be a neurological injury from post-COVID-19, which you might want to get checked out as well, especially if you have other signs or symptoms, or if it's getting more severe or prolonged in duration. Okay, the next most common sign or symptom of post-COVID-19 is number 82, lump in the throat. And I've been talking so long, I'm getting a lump in my throat, and it's drying out. So I'm gonna have to take a break pretty soon and get some water. But the lump in the throat, what can I say? Sore throat was one of the most common symptoms. Prolonged sore throat should be evaluated for secondary infection. A actual lump in the throat, perhaps they're referring to swollen tonsils or swollen tonsil, so it may be infected with, as a secondary infection with streptococcal, like a strep throat. Could be Epstein-Barr virus, like infectious mononucleosis, or the kissing disease can make your tonsils swollen, your throat swollen. A lump in the throat. Now, maybe they're not looking in the back of the throat, but they're looking in their, and talking, referring to their neck. A lump in the throat may be a lymph node, which could indicate either primary, secondary infection from the COVID-19, or from a secondary infection from a secondary bacteria. Once the COVID-19's suppressed the immune system and allowed secondary bacteria to grow. So anyway, this could be a significant symptom for evaluating with your physician. The swollen throat, again, if they're referring to the neck, could be a swollen thyroid gland and could indicate a cyst in the thyroid, a tumor in the thyroid, infection, inflammation of the thyroid, all of those things. And again, if it is the thyroid, should be evaluated by your physician, especially if it's getting worse, especially if it's associated with other symptoms. Again, the thyroid is not something to be taken lightly, and swelling of the thyroid, if that's exactly what it is. Remember, the thyroid's kind of in the middle of your neck, in the front, over your larynx, and goes to the side. So is larger than a lymph node usually. Lymph nodes generally from the viral infection are about a centimeter in diameter, but the thyroid is inches in diameter. So that may help you decide what the difference is. Anyway, large masses, increasing in size, painful, associated with other signs and symptoms, please evaluate as soon as possible by your certified medical specialist or primary physician. Okay, next number is 83, foot pain. And I believe we discussed this before. So we'll do the next one. 84 is irritated eyes. So anyway, the virus is a viral infection, commonly causes conjunctivitis or infection in the eyes, especially when the virus is active and multiplying. Remember, it hits the nose and mouth first. They're all connected to the eyes. The eyes are extremely sensitive to inflammation, and they become red and swollen, teary, and may produce an exudate, which is like mucus or scum inside your eye or dripping from your eye, especially if it's colored green or yellow or brown. Then it indicates a complication, which could be a viral infection leading to a bacterial infection, which obviously would require some antibiotic treatment as well. So another visit to your physician or clinic for evaluation. But again, the irritated eyes, a common complication of primary COVID-19 and possibly secondary complication of COVID-19. If it's severe, serious, associated with other signs or symptoms, or lasts for more than a few days, it should be evaluated by a physician. And if it's both eyes, usually it's infectious in nature. If it's just one eye, one would have to worry about something going on in the eye, such as a hemorrhage or infection inside the eye, and that should be evaluated. You can start with your doctor, but probably requires an eye specialist. Okay, the next most common is number 84 at Coveted Toes. So this is around 5% or less of patients have coveted toes, which the ends of the toes become painful, turn blue or red, various colors. These might be due to infectious emboli going to the distal ends of the toes, but usually are noted by pain in the toes with tenderness, followed by the redness or blueness, and usually can last for prolonged periods of time, like in several weeks. probably should be evaluated by your physician to make sure they aren't getting worse. But usually this is a more serious complication of, or indicates a more serious complication of post-COVID-19 symptoms. Okay, again, get this checked out. Make sure you're not throwing emboli. Make sure you. It used to be a sign of bacterial endocarditis, that is, bacteria growing on your valves in your heart and then breaking off and going to the distal areas like your toes and fingers. So again, you might want to get this checked out. Okay, next most common sign and symptom, and I say sign and symptom because the next one is number 85, was documented as, quote, low blood pressure. So again, this is it's not really a symptom. Most people don't have symptoms of blood pressure problems. Unless it does get too low, then you'd become dizzy and have maybe syncope, which is like lightheadedness and passing out. So that may be what they're talking about, rather than just measuring the blood pressure and noting it to be low. So obviously some of these patients obviously have a problem if they're measuring their own blood pressure frequently and noting it to be low. Again, if there are no other signs or symptoms, could indicate a lack of fluid, so maybe some more fluid intake. If it is associated with other signs or symptoms, and you do take your blood pressure and you note it to be low, then perhaps you should be evaluated to see why, because this could lead to syncope, passing out, and injury, and could also indicate other problems with your heart and your cardiovascular system, or even an increased worsening of your case of COVID-19 post-symptoms. So, especially if you measure your blood pressure and you're positive it is low, for example, your cuff is not malfunctioning, you try it on someone else and their blood pressure is normal, and you try it on yourself again, repeat it, and it's still low, then this may be true and you may need to have it evaluated. Okay, the next one is we'll go to number 87, which is dry scalp. This was also associated in the questioning that there was dandruff associated with dry scalp, which is usually a sign of seborrhea, which is probably a fungal infection of the scalp. But I think what they're referring to is just dry scalp and exclamation of the scalp, which is associated with the desquamation of the skin secondary to post-viral infection that we mentioned earlier. And again, it's a low percentage of patients. I would have to assume it's probably associated with the dry skin we mentioned earlier, dry skin and dry scalp. Anyway, probably not a big emergency. More hydration maybe help correct it. Once the virus is gone and the body has dealt with it and developed an immune system responding to it, then probably this symptom will recover. If it becomes prolonged, one would have to worry about seborrhea, as I mentioned earlier, which there are treatments for, and there is some evidence that it's caused by a fungal infection in some people at least, and so there are treatments for that. So again, the next most common symptom is number 88, and it was called, quote, kidney issues, unquote. Now again, I find this a common unusual and kind of weird statement for someone to be making about their symptoms, because it's very non-specific. Kidney issues. So that could be one of many, many different things. Kidney infections, kidney stones, pain in the kidney area, a lot of things. So kidney issues, a low percentage of patients have kidney issues. I would assume if they're serious, they are kidney infections, kidney stones, kidney pain. All of those, again, need an evaluation by a certified medical physician or clinic to see what's going on with those kidney issues. Again, probably not a direct result of COVID-19, although it could be associated with immune suppression from the virus, with secondary infections such as pyelonephritis or kidney infection developing, causing these, quote, kidney issues in less than 5% of patients who were surveyed for this study. Okay, the next most common, interestingly, is number 89, which is UTI. Okay, these patients obviously had a urinary tract infection as a post-COVID-19 discovery, sign or symptom. Anyway, to have a urinary tract infection diagnosed and put on this survey, it seems to me that they obviously saw a medical practitioner, had that diagnosis and probably treatment made. So again, I report this, they're already having symptoms. But yes, if you're having urinary tract infections, you definitely need treatment and probably antibiotics, as it's probably a secondary bacterial infection that you require treatment for. Otherwise it could damage your kidneys, and especially if it spreads through your bloodstream and cause major issues. So definitely get these treated. It sounds like they already were treated, because this is a diagnosis and not just a regular post-COVID-19 symptom. But it was listed on the survey. Okay, the next one, number 90, is called Hormone Problems. And again, this kind of unusual representation here, that how do these people know they have hormone problems? I mean, perhaps they're handling signs and symptoms of hormone problems that they already know about, or they've seen a physician and being diagnosed with, quote, hormone problems. There's probably an accumulation of various hormone problems, so I'm kind of thinking estrogen, progesterone, kind of hormone problems. The thyroid is a major hormone that can cause problems. So anyway, if you're having, quote, you probably need an evaluation and some diagnostic tests. Usually involves blood tests. But anyway, that would definitely cause hormone problems. Okay, the 91st most common post-COVID-19 symptom is recorded as thrush. Now, again, this is fairly specific. Thrush is a fungal infection caused by a yeast, usually Candida albicans, and so usually that would have been made by a diagnosis by a medical professional, possibly with a culture, and then usually requiring antifungal agents as a treatment. So anyway, approximately 5% or less of people surveyed post-COVID-19 had this sign or symptom or actual diagnosis in this case. Now what I would point out is thrush would be a secondary fungal infection after the COVID-19, not a primary infection of COVID-19, but probably caused by disruption of the immune system allowing the fungus to grow. So thrush is a fungus, a yeast actually in the oral cavity, usually, but can spread if it gets worse. Causes white plaques or patches, pain, trouble swallowing, possibly hoarseness of voice, and general malaise, not feeling well, etc. So anyway, if you do have thrush, this requires treatment and also investigation to why and how bad your immune system is after you've had post-COVID-19. Okay, the next one is number 92, was recorded as personality changes. So usually a patient will have a family member report personality changes because often the person having the changes doesn't realize that they're having the changes. Now again, this could be a serious symptom of a central nervous system involvement by the virus, such as an encephalopathy or an encephalitis, that is inflammation or infection of the brain caused by the SARS-CoV-2 virus, which is known to occur and is actually one of the most common symptoms. So this is a minor symptom, less than 5% complained by post-COVID-19 patients. Again, if this is happening, especially if associated with other neurological or other symptoms, please have it evaluated urgently, as this could be progressive and could indicate more serious problems. Okay, the next one, number 93, is GERD. That is GERD, gastroesophageal reflux disease. And again, this is a very common sign and symptom and diagnosis in normal medicine, but post-COVID-19, apparently this is a new sign and symptom and diagnosis, and again in the low minority of less than 5% of all cases based on this survey of post-COVID-19 symptoms. So anyway, if you have signs and symptoms of GERD, you should get it evaluated. There's medication for it, indicates abnormalities are happening. It could even be a cardiac problem happening. There are complications of GERD if it happens for too long and excessive amounts. It can even lead to carcinoma. So please get it evaluated and treated if required. And again, this is more a diagnosis than sign or symptoms when the diagnosis is given. Okay, again, the signs and symptoms that probably should have been given, as this is a symptom study, are chest burning, chest pain, feeling of stomach contents coming up into the back of the throat, sore throat, waking up at night with a sore throat and cough, clearing of the throat, and other symptoms such as that are the actual symptoms and signs of GERD, gastroesophageal reflux disease. Okay, the next one, number 94, is herpes. Now again, this is probably more a diagnosis than just a symptom. But I guess everyone knows what herpes is. Like at least herpes simplex, type 1, which causes the cold sores that people see. So I have to assume that's what they're talking about, rather than herpes 2, the genital herpes. But who knows? The symptom is just herpes. Now, usually to be that specific, one would have had to culture it and make a diagnosis by a physician. But I will assume they're just speaking of the symptoms of a cold sore rather than having the actual diagnosis and culturing of the herpes, supposedly simplex virus, and I assume type 1 in this case. But again, as a complication of post-COVID-19 symptoms, the virus can suppress the immune system and lead to secondary infections developing, such as other viruses, such as the herpes type 1 virus. Now usually the herpes type 1 virus is dormant in the body, and a suppression of the immune system causes an exacerbation of the signs and symptoms, in this case cold sores. So that is probably what has happened in this case. Anyway, usually these people know what the diagnosis is. They usually have medication for it. New onset herpes can be or should be evaluated and treated, often with antiviral agents. Okay, the next one is number 95, which is anemia. And again, this is more a diagnosis than a symptom. The patients must have seen their physicians and had a blood count and been diagnosed with anemia, which means a low hemoglobin level in their blood, which means usually low red blood cells and the ability to carry oxygen to their tissues. So again, anemia has a side effect of, or complication or symptom of post-COVID-19 is a little bit unusual, I think, but could happen. The symptoms obviously would be weakness, dizziness, syncope, dizziness or passing out when you stand up, and possibly shortness of breath, lack of energy, increased need for sleep, etc. Those would be the symptoms of anemia. But for some reason in this survey, the symptom was called anemia. And so, anyway, it was less than 5%. So we can contemplate that some more later. Okay, the next one, number 96, was elevated thyroid. Now this is interesting. This is another diagnosis. Elevated thyroid usually requires a thyroid test, or at least a physical examination showing the signs and symptoms of hyperthyroidism. So again, this is a low number. Low number of respondents. I'm not exactly sure what this means. Viral infections can cause changes in the thyroid. Hyperthyroidism or elevated thyroid can be due to inflammation, can be after a viral infection. Hyperthyroidism should be taken very seriously, should have an evaluation and treatment, and also to determine what the cause is, and if it is absolutely from the SARS-CoV-2 virus, which there have been cases, but most cases are not related to SARS-CoV-2 or COVID-19 infections. So anyway, if you have that diagnosis, please have a complete evaluation and treatment. Remember, the first George Bush president passed out when he was in Japan, and it was because he had hyperthyroidism, Graves' disease, it was called. So this can be very serious and can affect many people, including a past president. Okay, the next number 97, is throbbing neck. Sorry, a big huge mosquito. Throbbing neck. Okay, what's this mean? Throbbing in the neck is a pulsation in the neck, I would assume. So associated with maybe pain, so neck pain. Throbbing, usually if it's on the synchronicity with the heart, would be associated with blood flow. So possibly with inflammation and possibly the thyroid, I would think. So anyway, a throbbing neck, I would think you would have to have it evaluated just to see what's going on. Kind of an unusual symptom, low on the percentage of reported symptoms for post-COVID-19 symptoms, but again, could be significant. Something's going on which is not really obvious at the time, just from 2 words. Okay. All right. And I get now to the last one is syncope. Syncope, this means passing out or getting lightheaded, such as when standing up is a common symptom, but the usual result is either decreased level of consciousness or loss of consciousness, which would be called passing out. This is a serious sign and symptom. It was the lowest on our list, but one of the most serious and should be checked out. If someone passes out, probably wise to call 911 and get them checked out, especially if they're having other signs or symptoms. They may need a thorough evaluation and thorough treatment. Okay, that ends our signs and symptoms of COVID-19. I'm here on the bank of the Gold Creek in the Golden Ears Park, part of Garibaldi Park, which is a major federal guarded national park in the Canadian government system. So I hope you enjoyed the video. If you did, please subscribe to further ones. This is number 4 in the series of 4 on post-COVID-19 symptoms, the most common 100. We have done 100. The first 50 were in lecture format as a slide presentation with photographs and discussion and captions. These were less significant, I thought, the last 50, and less specific and less directly related to post-COVID-19 symptoms, so that's why I'm doing them by verbal format in this nice place, beautiful, nice place here. I hope you enjoyed the babbling creek behind me, and I hope it didn't drown everything out. We will continue with other lectures, other formats, other videos on YouTube. Please subscribe, please comment, please forward to your friends, and please thumbs up. I would appreciate that, so I will keep doing more of these if I know they're appreciated. Okay, thank you very much. Gary Ordog, MD, signing off on the 100 most common post-COVID-19 symptoms. Stay safe, get your vaccination, and be healthy, be good. Thank you.